Thank you for joining us, Barry. It's good to
Thank
see you.
Glad to be here.
It's been too long. Your story's interesting, and I want people to kind of get to know you the way that I know you a little bit. Did you start out as a psychiatrist?
No, I started out as a little baby.
Born a psychiatrist.
Eating, pooping, and drinking. That was it.
No, but when you got into medicine, was this what you knew you wanted to do?
Absolutely not. Oh, when I got into it, it was semi-was. I was a very troubled teen in high school, and I drank a lot, and I got arrested 3 times in high school for minor offense. And so I had a reputation as a hoodlum. And I guess I looked like a hoodlum because I was very muscular at the time and wore a leather jacket all the time, pre-Fonzie, but I was like that. And I went into the Navy at 17 for 2 years of active duty because I didn't know what I wanted to do with myself. And I figured, well, this will be a chance to go places. Join the Navy and see the world was a very common phrase then. And there was a draft on, and I was actually at 4F because my belly button stuck out, but I actually had it fixed so I could get into the Navy.
Oh, really?
So whereas everyone else was so glad to avoid the draft and get out of the military, I wanted to go in.
How would they not let you in with your belly button out?
By definition, it's a hernia.
Oh.
It's called an umbilical hernia.
Oh, so an Audi is technically...
An Audi is technically a hernia.
Weird.
If it's still an Audi.
Interesting. Had no idea.
Yeah.
So got that fixed.
I got that fixed. And I got into, and I went into the Navy for 2 years and had a mix of incredible experiences when I was in Hong Kong and Singapore and seeing people living on the streets in cardboard boxes and stuff like that. It was before it's now commonplace here in Los Angeles.
Yeah.
But it was worse there, and I'd see kids with flies and maggots on their faces and shit like that, and in Hong Kong, Singapore, but also lovely experiences in Japan and stuff like that. But being in the military taught me something that I should have known already because I had been a troubled rebel in high school, and was that I can't have bosses. I cannot have bosses. So I figured one way of not having a boss is to become certificated in something. I figured I better go to college, and I don't know what I'll do. Because of my lousy grades, as in shitty grades, in high school, I had to go to LA City College for 1 semester. Turns out you're supposed to go for 2 years to junior college to prove that you can. But now that I cared, I got straight A's at LA City College in 1 semester. They let me into UCLA under a special program called the Gifted Students Program, as in gifted with promise. And so they let me in. I was so thrilled. I mean, it was just so thrilled because I felt like such an outlier, outcast, and an outsider. And it just made me feel, wow, I've been accepted into this school. You know, and it was really a challenge because I had gotten married to my first wife at that time and had a baby within a year. And that little baby is older than I am. Now he's 63.
I know I don't know how that worked, but it happened.
Yeah, it's strange. Well, he smoked a lot of weed. So it does these time shifts.
Yep.
So I did not know what to do and what to major in. While I was still in the Navy, a girl had picked me up at the airport, and I was very grateful. She was reading a book by the philosopher Descartes, René Descartes. And I said, "Oh, you're reading Descartes?" And she quietly said, "It's Descartes." And I didn't know that. So I became a philosophy major. This was long after I'd stopped seeing her. Because I didn't know what else to do. And I really loved it. But what I really liked was the literary expressions of philosophy. And in particular, the writings of Jean-Paul Sartre and Albert Camus and stuff like that. So I think, but I love literature. Okay, I'm going to become an English major at UCLA, an English major. So I'm reading Hemingway and Faulkner and E.E. Cummings and all these other wonderful writers. I realized that I really liked stuff that was called modern literature at that time, which meant things written since 1850 or 1860.
Oh, wow. Is that what was modern?
That was called modern.
Yeah.
So I started reading Dostoevsky and Tolstoy and Turgenev. And 2 nights ago, I finished rereading, after almost 70 years, a William Somerset Maugham novel of human bondage. And as I look back, and I read that when I was 17, was one of the few literary books I read. I did read then, but I used to read science fiction, which I loved. You know, writers like Isaac Asimov, Robert Heinlein, and blah, blah, blah. and sports stuff, but not serious literature until I got into UCLA. So my third major was modern literature, reading that. And then I somehow put together that and the fact that I got fired from my part-time job at a pharmacy as a delivery boy for my 75 cents an hour, the then prevailing wage. It did go up to 80 cents an hour. And actually, I finally got to $1 an hour in this. And I got fired from the job because my first girlfriend, who became my first wife, real girlfriend, became my first wife, was her family invited me to join them for a week in Las Vegas, where they went and stayed at a little motel and enjoyed the benefits of Vegas, which were mostly shows and good and incredible food for very low prices. So again, I arranged for the other part-time guys because I worked every afternoon from 3 to 9, afternoon and evening, and all day Saturday. So that's why
They covered your shifts.
Yeah, they covered my shifts. I proudly go to the pharmacist and tell him that this is going to happen. He says, "Oh, you can't do it." And I said, "What?" He said, "You didn't ask me first." And that really, really solidified for me the issue that I cannot work for arbitrary authority. Mm-hmm. I thought I was doing a good thing. He thought I was doing a bad thing because I should have deferred to him.
You were honestly overly responsible.
I was overly responsible.
You're like, I've already taken care of it. You don't have to stress.
That's what I thought he would understand and value. Nonetheless, I had to continue for a week. I'm thinking, I'm going to be fired. I'm still delivering in the Volkswagen. They first started to import Volkswagens. This was 1959, by the way. And I'm delivering in the Park La Brea Towers adjacent to the farmer's market where this pharmacy was.
And they're still there.
And they're still there. The towers are there. That pharmacy isn't there anymore. And the pharmacist, Jack, said, if you go, you can't come back. But I'm delivering. I'm thinking for the first time, because I'm delivering psychiatric medications to people in Park La Brea, and I'm thinking, psychiatrists don't have bosses. Psychiatrists sit alone with a patient in a room. That was my image then.
Yeah.
And nobody tells them what to do. And they make $15 an hour, and I'm here now making $1 an hour. Jeez.
Sounds pretty good.
So that was my initial interest. And so back to my career at UCLA, which continued to a fourth major, I took pre-med classes. So it used to be embarrassing to me, say my first thought about becoming a doctor or a psychiatrist was simply I didn't want to have anybody telling me what to do. And
I think a lot of us choose things that way, if we're honest. Because the reason that I want to be a therapist is I used to love knowing everybody's secrets when I was a kid.
Yeah.
And I took pride in the fact that I would never share it with anybody else. And I was like, this sounds a lot like therapy.
Oh, then I'm doing something wrong because I video all of them and send it to people. I get paid a lot of money in blackmail money. Oh,
That's how you've made your millions.
Yeah, that's right. I don't know whatever happened to them. I loved it. I actually loved, the pre-med classes, which were, especially zoology and embryology and basic chemistry and physics.
Oh, really? Difficult classes, though.
Yeah, and I could do many sidebars about how much those have contributed to my enjoyment of life in the world. So it made me into a better person just to know that much about science. But when I only applied to 2 medical schools, UCLA and UC San Francisco, because I was working my way through college and I had my first wife and the baby, and I couldn't afford to go to a private school. I did get into both of those schools. Fortunately, because my grades weren't the 3.5 minimum, but they made I had grades of like 3.2, but I was working full time and being a father and
yeah, it's a lot going on.
Exactly.
3.2 is amazing.
Well, so that's right. They gave me credit for the military too, I might add. And so I got into both of those medical schools. I went to UCSF because I wanted to live in San Francisco. I hadn't even told my parents that I was going to medical school till a week before I left because of prior, intense neurosis about my family. But I went up there still thinking only 60-40. Do I want to be a doctor? At the end of the first year, I was 70-30. At the end of the second year, it was 80-20, et cetera. And I loved it. And I've loved it ever since. But I also continued to love medicine. So even after finishing my medical school, I wanted to do what's called a rotating internship, which is where you get to deliver babies and do pediatrics and stuff
Oh,
like
okay.
that.
You kind of float around wherever
Yeah,
they
float
need you.
around. Yeah. So, and I wanted to do it in New York, New York City, because I knew I would never live there because I'm a born Californian.
Like I say, you're a Hollywood boy, born and raised LA.
Yeah, absolutely. And so I figured, so I went and I got a Maimonides Medical Center in Brooklyn, and a rotating internship. I had incredible experiences doing that, and I loved emergency medicine so much that I then did it for 17 years.
That's what I thought, because I was like, I remember you being in emergency medicine. I always call those people the adrenaline junkies.
I'm still an adrenaline junkie.
I am too.
17 years of about 36 hours a week, really. They were 12-hour shifts, 3 12-hour shifts a week, or the equivalent thereto pertaining, and 40 hours a week in my office in Beverly Hills. So I was a psychiatrist and an emergency room doctor. I worked about an 80-hour week. Meanwhile, although my first marriage had broken down, and what it did do was make me into a snow skier, but I had met my now wife, and we've been married 54 years. It's a beginning. We'll see how it works.
Yeah, we'll see how Erica's okay. You know?
She is. She is okay. And so, I felt like I was doing a lot of good participating with our 3 daughters, whom I worship. And now they're 53, 50, and 46.
Wow.
And my youngest daughter is a family medicine doctor doing very similar things. And my oldest daughter, Jessica, she majored in literature, and she was going to become a psychiatrist too, but now she's a college professor teaching humanities and visual imagery up in Rochester, New York. And she's setting up an alternative campus even now here in LA for
very cool.
for Hollywood placements for students who are interested in
That's
that
smart.
part of but they are brilliant students at this RIT school, technology school. And she's highly beloved in that school.
I'm sure. So they each kind of have an interest that was on your path to where you got.
I love that.
I would.
I love that.
And your wife also. We have to give her credit too that she's a licensed clinical social worker, correct?
Well,
LCSW?
she was a counselor. She got a master's degree in vocational rehabilitation counseling.
Yes, okay.
That's where we met, at the VA hospital
Yeah.
here in Brentwood. And then she was 22 and I was 29, and I had a bad reputation.
You never.
Well, I had come into my own. All of these previously referenced experiences made me feel pretty confident about dating and other kinds of stuff like that, especially having recovered from the unwanted breakup of my first marriage.
Yeah.
But we were married too young. She was 18, I was 21. We had babies. She was 19 and I was 22.
Too much, too fast.
Yeah, exactly.
Yeah.
So for me, one of my lifelines, lines from my life about all these things is, if it's worth doing, it's worth overdoing.
Sean also lives by that. Yes.
Yes, to his credit.
So when
I stopped the overdoing of the drinking, though.
Yeah.
All those years, I didn't drink anymore.
Yeah. Now you just enjoy a glass of wine here and there.
I enjoy a glass of wine every minute or two. Yeah.
How did you decide to let go of emergency medicine? Was that a tough decision, or was it just time?
It was made for me because, this one was a hard one. I hate to give up anything. I mean, I'm a saver of old newspapers, of baseball cards, whatever, all
You
my
don't
life.
say.
I
National
know.
Geographic.
Yeah, I tell people I won't even flush the toilet because I hate the sense of loss. But nonetheless, they made emergency medicine a specialty. The USC, it was it
wasn't
junior,
when you started?
It wasn't. SC is a junior medical college for in downtown LA, and they started an emergency room residency, and what they did, they went around to the city contract emergency rooms, which were the ones that I like to work in. I worked in many of them, but those are the ones where the ambulances would take patients there. So I've delivered many babies in emergency rooms, and saved some lives. I remember there was even one day where I actually, on a 24-hour shift at one of these emergency rooms in Burbank, I actually saved 3 lives in that one shift.
Wow. Did you just come out just feeling like
I
a
came
million
out.
bucks?
I came out feeling like God,
Mm-hmm.
and I went home to Erica and I said, today has validated my entire career. If I never do anything more, it's been worthwhile today. Today, 3 people came in that were dead or dying that are now in the hospital, but they're alive because I was there.
Yeah, isn't that amazing?
Oh God, it was just
That's when
wonderful.
work is so fulfilling, when lives are legitimately saved or
They really
changed
are.
in big ways. And
They really are. And the first TV show that I watched a lot that really showed it was called ER. But nonetheless, the SC kind of required all the city contract emergency rooms to use their graduates in order to attract people to their program. So I was grandfathered out, but I realized I was full-time in psychiatry in my office in Beverly Hills. And I still prefer doing psychiatry, although I miss emergency room.
that's what I wonder, because it
For
still
years,
feels like it's a part of you.
For years, I had this thing of this is the motion with your hand and wrist when you're putting in sutures. And
That
I'd actually
curve.
found myself with that curved needle. And I did that for years unconsciously, where other people would fiddle their thumbs or fingers. I was putting in sutures.
Oh, funny. That's like my mom, because she'd learned to type because she was a secretary for so long. When she would get stressed, she'd type trouble,
Oh, yeah.
like air type. All through my childhood, when I'd notice her doing this with her fingers, I'd be like, how much trouble is we in? A little nervous tick.
Just watch your fingers. You'll see,
Yep.
especially if they're really pounding
Exclamation,
on
if it's
them.
caps. That's interesting. I didn't know that they essentially forced you out of emergency
Yeah,
medicine.
because you could still work other emergency rooms, but not the city contract.
And those are the ones
the
you
city
like.
contract. That was the drama. Yeah, that's
Yeah.
the one where I really felt exhilarated.
Well, those would be as weird as it sounds to say, that you get all the best cases. Like, things were coming in all the time.
Oh,
It was
yeah.
like picking people up, and
Oh yeah,
yeah, it's like probably a very active
yeah.
emergency room.
yeah. And I'll spare you of any the stories, but one time one of the head writers, it was a doctor who was an ER doctor himself, and he was one of the head writers on that show ER on television, 30 years ago, whatever that was. And we used to swap stories back and forth, and although it doesn't matter, it wasn't credible, but I saw several of the stories that I shared with him.
Oh, very cool to see
done
them.
on that show.
Yeah.
Yeah, I mean, I'm sure he would say that wasn't true, but
You
some
know
were
it to be true.
Yeah, even so that one of them that I found myself standing up next to my TV screen, with the same feeling of desperation that I felt when that
when it
event
was happening.
even on the rerun.
Oh, wow. You still remember? Yeah. Well, it's a visceral, we remember, our body
Yeah, this
remembers.
this is one of the times where every right thing I did was wrong,
Mm-hmm.
and every wrong thing I did something right, and it turned out to be wrong and stuff like that. So not everything was success.
Well, and you never know. I mean, I feel like in a lot of health fields, they can teach us as much as they can teach us, but every person's so different that you don't know. And in some situations, you can feel really helpless,
Yeah,
Yeah. But emergency medicine, because I wanted to be a psychiatrist when I first started school, and then putting myself through school and the cost of education quickly became like, I don't think I'm going to do this. And that's trying anatomy and physiology for a couple of weeks really just nipped it in the bud there for me. I was like, I'm really having a hard time with all this, man. I was taking like 18 units. It was just too much. And I was like, now is a good time to look for, maybe I'll become a psychologist.
and you've done very well at doing it, sweetie.
Oh, thanks, Barry. Yeah. So then, okay, we're no longer doing emergency medicine. Tell me around what time it was when you went into full psychiatry. I mean, you already were full time.
1971. I'm sorry.
Did you have your office, the same office?
April 1st, April Fool's Day,
April Fool's Day.
1971. Because
The best office.
Because at UCLA, I was doing this combination of psychiatric residency and getting a master's in social and community psychiatry, which only UCLA and Harvard granted that degree at
really?
that time. And so I finished like 9 months after the rest of the people in my group finished. And so I went and I sought out office. I wanted an old-fashioned office like the ones in Westwood, but there were people waiting in line.
Oh, those have always been so.
old
And
buildings.
those buildings, I don't even know if many of them exist in
Oh
the
no,
way.
they've torn them down because
Yeah,
of
they're all these
earthquakes.
modern. Yeah. But your office
But
was
my
a
office,
special
which
office.
my special office, which I had shared an office for almost 2 years with a friend of mine, another psychiatrist. But we got in each other's way because we both got to full time within a year or two, and right around the corner in Bedford, Mike, Paul, and I. And I started to look. I had two weird experiences looking for a similar office, like with windows that open and
Imagine
bricks
that.
and stuff like that. And a number of the buildings wouldn't rent to me. Oh, they wouldn't rent to a psychiatrist. I said, why? Well, you're going to have crazy people come and piss in the hallways.
Oh my God, the stigma. Because that's what I'm curious about, like what psychiatry looked like then,
What psychiatry looked
especially
like
outpatient.
it was associated, almost everybody, it seemed almost everybody, thought of it as just treating severely mentally ill people. And,
Wild.
and because certainly that had been part of my residency, I was, spent a year at the VA hospital in the inpatient unit, a year at Camarillo State Hospital, then existent inpatient. And so I was actually quite comfortable with severely mentally ill people, trying to help severely mentally ill.
I never minded it either in my time. I worked for Prime. It's a chain of hospitals in Orange County and up into LA. And I enjoyed it just the same. I feel like it can be not more rewarding, not that there's like a level, but very comfortable. I feel like the one thing I do love about people in that setting is that there's not as much maybe shame about it. They're very honest. Like I remember one of my patients would tell me like what I would consider maybe like the wildest or what could be embarrassing things, just very matter of fact. Like one was like, this medicine makes me wet myself, so I wear a diaper sometimes. Like that was just a thing. That was just what it was. And I was like, maybe we should talk to your psychiatrist about lithium not being a good fit. How come you haven't told anybody? Oh, it's no big deal.
Yes, indeed.
So it is it is a different type of patient.
Well, it is, and somehow you just remind me of one of my favorite patients that I actually did see in outpatient practice. I saw a guy who was court ordered, mentally ill. He had been obsessed with a young movie actress and been arrested for stalking her on sets and stuff like that. And he was sent to me for psych evaluation, one of the few relatively non-voluntary patients who came to see me. And when I talked with him, he was a delightful, funny guy. But when we talked about how this girl was inside his head and controlling his thoughts, it was like craziness filled the room.
Interesting.
But I was comfortable with him because of the previous experiences in hospitals. And after my first session with him, the next patient I had who came in was a patient that I still have contact with. He was like a 6'4", big bruising guy, delightful, smart guy. And all of a sudden there's a banging on my door, and the guy who had just seen the mentally ill guy says, "I just realized you're part of the plot."
Oh my goodness.
And I said, "No, I'm not." I said, "But I'd be very interested in why you think that. And, when you come next week and we talk, we'll talk more about that."
Look at you wrapping that up. So nice.
I was actually pretty proud. The big patient, that's right. The new patient who came in said, "That would have scared me to death." And I said, "It might have scared me to death 15 years ago, but
now I feel like working in a hospital. That's one of my recommendations when people wanting to get into psychiatry, psychology in some aspect say, what advice would you give? And I was like, work in a lot of different settings.
Yes.
Because then outpatient or whatever you end up doing, you kind of, I feel like you have your wits about you. You know the gamut. And you're like, I can manage all of this.
One of my favorite stories, which is not about me, but it was about my latest wife, who above referenced. When I met her, she was doing her internship and at the VA hospital here in Brentwood. And she didn't have that wide variety of experiences, but what she was taught to be was she was a bit of a tomboy. She had two older brothers, would throw footballs with them. And this one time, shortly after I met her, she was brought in a new patient to be interviewed in the little teeny offices there at the VA. And this new guy, he took his scissors off the desk and just held the scissors up to her neck. She quietly talked to him for a few minutes.
Wow.
And he then put the scissors down, and then she said how it was kind of uncomfortable, but why was he doing it? And so she had the presence of mind without the wider or deeper set of experiences. So I think it still includes having a brain in your head.
Yeah, having critical thinking skills.
Yeah.
Yeah.
And realizing that I have to adapt to this. I may not be familiar with it, but I'm here and I'm serving a role and I'm trying to help this person.
Yeah, that's amazing.
And I loved that about her.
Yeah, Erica is kind of calming.
And she is.
I would say, yeah. Not that you're not calming. Just she seems sure of herself.
She is. She has really one of the most mentally healthy people I've ever met.
Yeah, and it just, yeah, I've always enjoyed her. She's very, very nice, and obviously very good at her job.
Yeah.
And so so 71, we're in our private practice. Did you have what I would call, what we'd say now, like most of our patients are, people struggling with anxiety or depression, or was it the more severe cases, even outpatient?
Well, I had a few severe cases like the one I mentioned, and a number of them. I mean, one person was so agoraphobic, I had to hop on my motorcycle and go over to her house, and took about 20 minutes to get her out of her front door. And so I had a variety of experiences that I was willing to do. But most of the patients were coming in with depression, anxiety, marital troubles, the garden, what Freud used to call, or many people call, normal-neurotic, problems.
Which
Which we all are familiar with and work with. And that's easier in some senses, except for the people who have personality disorders, because they rarely, my Freud references to include that he wouldn't treat people with personality disorders because they usually lack the capacity for self-reflection or regret.
Do you still think that's true?
I think it's true often. But, I think of certain political figures that I can't imagine ever going to a therapist. And, it's like,
Some people are very averse, especially what I would call, we used to call cluster B, but it's kind of the narcissist.
The narcissist, yeah.
Yeah, the antisocial personalities, those types of, because the self-reflection means more wounding.
Yeah.
Or more admission of issue.
Yeah, well, you have to admit to a greater weakness than you already feel, and of course narcissists and paranoids too. Paranoid personalities are very, very weakness averse.
Yeah.
And so if you can't admit to weakness, and you certainly can't change anything about yourself, which is almost always the culprit in your difficulties in life.
100%. Yeah. When you were seeing what we call these like run-of-the-mill, usual neurotic medications that were available, what was out there?
Well, when I started,
I'm like Haldol. Is that it?
Well, yeah, that one I hated.
Yeah, never liked
because the inpatients psychiatrist at those times, I had a person who said. And another doctor said, you're a psychiatrist. I can zine them just like you do. They used to use stelazine and thorazine, and compazine and chlorpromazine. Anyways, but so they were all pretty primitive by today's standards. They had lots of
what we call dirty
effects.
drugs. Yeah, side effects.
They were. And a comedy writer named S.J. Perelman used to write for Groucho Marx. One of the titles of his book is The Road to Milltown. Well, Milltown, which is Meprobama, it's still around, but that was one of the first kind of in what became the Valium, Xanax. So the benzodiazepines are a lot cleaner than those old ones. They used to use phenobarbital to help people sleep, or other kinds of barbiturates. And so the medication palette has dramatically improved with far more effectiveness and far fewer side effects.
Yeah.
But nothing works for everything.
Of course not. There's no like magic bullet, and there's always complications.
Yeah. Well, I always say I have the magic bullet, but you're not paying enough.
That's a very Barry thing to say.
Yes, it is.
So you still see your patients for an hour, correct? Or 50 minutes?
Well, yeah, about 50 minutes. Although it's often an hour because I can't stop talking, let alone stop listening.
When did it shift? Because I started practicing in 2009? even in this time, I think there were still more psychiatrists that were seeing patients for an hour. When did it shift to what we call med management? I don't know if you have any thoughts about that?
My thoughts about it rise to the level of pet peeve.
Same.
I am really bothered by the fact that has evolved. Psychologists, back when I started, were often referred to as rat psychologists, not because they were rats, but more that the focus of the psychology was all on experimental learning about rats.
Research.
And behavior. It was research. And B.F. Skinner was still one of the most important.
The Skinner box.
Yeah, the Skinner box, and functionally behaviorist. And then, of course, so Freud and Jung and all those early guys in the psychoanalytic milieu were often, almost always, Freud was an MD. So that was still considered part of medicine. Psychiatry, early psychiatry was part of medicine. But this division happened between psychology and psychiatry. And but ironically, and not necessarily bad, psychology programs became more and more psychoanalytic and focusing
Yeah, we kind of
more.
took the clinical.
They took the clinical and the dynamics. And the psychiatrists became more and more biological and medicine oriented. So now I hear frequently people, some of you refer to me because you're the only psychiatrist we know who does psychotherapy.
Yeah, because most don't. I have had a tough time. Even in Los Angeles, right, there's zillions of psychiatrists, zillions of therapists. If you want to refer somebody out, because the frustration that I feel on the other, as the clinical side, is that if I send them to somebody, I want to make sure they spend time with them and do a thorough history.
Yeah.
And most of the time they won't return my calls, so I can't give them the information that I have so that they're prepared. Instead, it's like, here's the medication I always try first with my patients. Here's the medication I always try second. And it's like, we've got to be doing better. But instead it's like 10-minute appointments, which, doesn't work. And it's frustrating. It's a pet peeve of mine too. And I don't even think they train psychiatrists to do therapy anymore. Do they? Would we know? I don't know.
I don't know. Actually, I don't know that. What I do know is that so many people, because you can see a higher number of patients per hour and can probably bill more, whether it's this individual psychiatrist's interest in making more money or whether the corporatization.
Well, if you're part of a hospital program or Kaiser or whatever.
There's a tremendous pressure in other branches of medicine too, in virtually all branches of medicine, in these corporate things of getting the volume of patients up, and which means the time spent with patients
the
down.
quality, I argue, down. Yeah.
Yeah, so we have lots of people say, we in America, we have the best doctors in the world. Yeah, but we have about the worst delivery system in the world.
Yeah, that's very true.
And so I hate what you were just talking about. I think it's a real violation. I even have some you may need to cut out. I mean, to me, it's like the difference between visiting a prostitute or being in love with somebody.
Yes, I don't think that's wrong because you don't know the other person.
That's right.
And you're just there for that thing, the medication
That's
or the
right.
sex or whatever. It's like an exchange and it's very quick. I think, I don't know if you know when it started to shift.
I think it shifted in the late 70s and early to mid 80s. Well, what was happening was that, and even there was even organized psychology, actually the American Psychological Association, for many years was trying to get the psychologists an okay to prescribe medications. And of course, the American Psychiatric Association and other organized people, and including me probably, although I had no public voice about this, said, geez, we don't want people prescribing medications who aren't really knowledgeable physiologically. And,
so they put the emphasis on the medical piece.
And so the medical piece still is not, well, antidepressants work 67% of the time, so I'm going to give you this. Well, but if a patient has some side effects that are hard for you to understand, you don't know whether the side effects are due to the medication. You don't know if they have some underlying disorder that you've already asked about.
True, because not everybody's forthcoming of what's going on.
Yeah. And there's all kinds of cardiac and biologic, diabetes and any number of things that people won't think to tell you.
Yeah, because they don't think it's related.
Yeah, and if the patient may not know that, the therapist and the prescriber should know enough about those things to be able to have a better understanding of the overlap between human physiology and human physiologic disorders and seemingly psychiatric or psychological disorders. We are a composite. We're a stew.
It's frustrating because they're trying to carve out something that doesn't need to be carved out. Like if you like I always refer my patients to go get a physical because I want to know if there's anything organic that could be like, do you have low vitamin D and that's why you think you're depressed? Could be. I should at least send you and get blood work.
That's right.
And then have the doctor tell me what that means because I don't want to pretend that I know more than I do. But that's a piece. It's almost like in general, the stigma and the way people talk about mental health exists the way that it exists because they want to disconnect our brain from the rest of our body and pretend that it exists on its own, it causes its own chaos and damn it, that thing, and then the body. And I'm like, the brain is the hard drive. And so if that's not working out, like someone could think they're having a heart attack and they're having a panic attack. And we should be able to treat both.
By the way, that's where the ER came in. I would say by far, I saw so many people coming in with quote, heart attacks, or I'm having a stroke. And I'll say,
yeah, you're having panic.
Well, this happened once on an airplane. I saw this big, strong guy. Is there a doctor on board?
I was just going to say, did they ask?
It's the one and only time I ever got a chance. I thought, oh, here's a good. I can be a hero. And I go to where the stewardess is with her, and I see this strong guy standing there, with probably 40 at the most. He says, I'm having a stroke. And I said, no, you're not. He said, how do you know? I said, because you're standing there telling me you're having a stroke.
You're talking to me right now.
Exactly. So what are you experiencing? And we talked, and he told me rapid heartbeat, et cetera, and I kept asking questions on the airplane. And it turns out he was flying with a celebrity client to the Oscars, and he was really having a very hard time because his mother had just died, like within a month.
Oh, no.
And he was starting to
Talk
feel
about
really
overwhelm.
He was feeling really scared to be on the plane, feeling trapped. And it was clear. I mean, I'll give you save you more detail, but he was having a panic attack.
Yeah.
And especially because he's trying to hide it from the
of course,
woman
pretend
sitting
everything's
next to
okay.
him. That's right. And I just happened to have Xanax in my pocket, in my shirt pocket, and one. And I said, let me give you this. I almost had to push it into his mouth. And after about 20 minutes, I'm holding him in my arms while he's sobbing in my arms. And I accompany him back to the seat. And meanwhile, of course, there's all the applause from the rest of
the doctor saved the day.
I loved it. But things don't always work out. Another medical thing, this was, he thought it was medical when it was psychological, emotional, psychophysiological. The other story that popped into my head while you were talking was about sometimes the opposite. There was a patient that somebody renting that little room from me in my office I had for years ago, who was a psychologist, and she was had been seeing this woman for a long time, and depression was her main thing, but also terrible marital problems. And she asked me to come in. She said, she's so depressed now today. I've just never seen her this depressed. So I went into the little room, and I'm looking through this woman. This woman was so pale.
Oh, was she anemic?
She was so anemic.
Oh, was she the one with the eye when you told me you looked into
I do that a lot of times where I look inside people's eyes.
see.
Well, I pulled down, and the white of her eye was contiguous with the white, with what should have been
because it
the
should
pink
be red.
of her
For everybody
conjunctiva.
listening, it's supposed to be red. That means you have enough iron in your blood.
That's right. Well, this is, even though it's a self-serving story, it's also a sad story. I walked her because she couldn't even get up and go to a lab around the corner on Bedford. She was so weak. Normal hemoglobin is, for a woman, should be 12 or 14, and she was of an age, she could have tolerated 10. She was 4. She had a hemoglobin of 4. I remember that because it's the lowest I ever saw a person who could walk. Yeah. And by the way, and I called her family medicine doctor and got on the phone with him and told him that. And he said, well, she got an appointment tomorrow. I'll see her tomorrow. Oh. She was dead the next morning.
Oh, you're kidding. Oh, that's so terrible.
And I had said to this doctor, I think she needs 4 units of transfusions.
Yes.
IV blood. This guy, by the way, he did call me afterwards and apologized vigorously. But it's not that I'm
woman.
it's not that I'm so smart. It's just that some things you can just tell.
You could see her. She didn't look well. And wow.
But her therapist was so used to treating her depression and was not good at picking up on physical
Well, we're not
signs.
medical. We're not trained medically. That's the trick. That's the carve out that's frustrating. That's why I get mad that psychiatrists no longer offer therapy, or maybe some do. I just don't really know who does.
Well, when people ask me when I say, look, I'm 86 years old, I'm not taking that many new patients unless they're very specifically referred by somebody I know, blah, blah, blah. They'll say, well, can you refer me to somebody who does both therapy and medications like I was told you do? And then I get really stuck because I don't know
anybody.
No, and I'm not saying that there aren't any people. I don't know them. I should also add that apropos, consistent with this thing that has stayed with me about not having bosses, I stopped doing hospital work many years ago, even though I was very inspired by the hospital work. But hospitals more and more have protocols and stuff like that. And if you don't give the patient a certain kinds of medications on the minute they come in.
Yeah, well, they have their...
The insurance won't cover them.
And you follow this chart, because I worked in the hospital system more recently, and it's no better. And I would argue potentially worse than an outpatient psychiatrist, because I would see the patients, I'd mark up their charts, I would get it ready, and the psychiatrist would simply sign them. And sometimes they'd see them, but again, it's like it's a churn and burn. It's very quick. And when they would come, because they'd come once a week to see the patients that I saw, I mean, the stacks of charts were huge. There's a ton of people that they need to get through, and I see them on the weekly basis for group. And then we have like the psych nurses offering support for medication. It's almost like they've covered all those other bases, and the psychiatrist really doesn't, I wouldn't say has patience. Do you know what I mean? Like they don't see their patients. And it's been disappointing me. I'm surprised that it started in like the late 70s, early 80s, because when I first met you, let's say in 2009, 2010, I don't know when I exactly met you, but
I think it was earlier than that, but when you worked for...
Yeah, it'd be like 2010 probably.
Okay.
Maybe 9. But anyway, when I first met you, there were still quite a few in the area
that
did do psychotherapy and medication, but they were always older. It was not the new. It's like they weren't training them to. New ones. That's right. They weren't training them to do it.
That's correct. When I was trained at VA, Camarillo, and UCLA, psych residency, it was psychoanalytic. Psychotherapy was still the predominant modality, and they called it dynamic psychotherapy and stuff like that. So it did focus on the past. I was more here and now. Okay, let's see. I would want to hear about the patient's past and see how it fit in, but I would do what I called it cognitive psychotherapy.
Oh, so a mix of CBT with...
Yeah. So those things were there. But I also called it the therapeutic use of the self, which was something that I read. There was a guy named, I think his name was Michael Grinker, if I'm correct, in Chicago, long gone. But he had used that phrase about using everything that you bring to the table or to the couch or to the chair.
Yeah.
And that one stayed with me. And so, and people say, well, what kind of therapy do you use now? And I'll say, well, I'll listen for a while, then I'll start yelling at the person.
I've even had like people that I've referred to you, and I always feel like you teach through stories, which I think is a much better way. People learn more that way versus being told, because they get to take from it what they're able to take and leave what they can't accept yet. And I think that's it's an art. And I feel like therapy in general, when we offer psychotherapy as a whole, is an art.
It's an art. It is,
and
absolutely.
You have to, and there is utilization of self, because you're pulling from your own experience and your own world to try to help them make more sense of theirs. And that's why I've never liked psychoanalytic, where you're like faced away and free association.
And taking notes.
Yes.
I would talk about it, especially if they were in training, psychoanalytic training, they would take continuous notes, and I'd have somebody say, I did see this psychiatrist or psychologist, and he or she, I never saw their face.
Yeah, because they're always taking notes. There's even psychiatrists that would, back in the day when I was a sales rep, they would be on their laptops. Yeah. And I'm like, that is just not effective.
There's no advantage.
What do you do?
I
know. What do you do? And it's so crazy.
Unless you have good secretarial trainings.
I know.
You can do touch
type
typing.
Underworld, right?
But But this is again reminding me of the gripe about the changes in psychiatry.
Yeah.
Have permeated into general medicine. One of my 3 favorite daughters, who's a doctor, she has just gone into private practice after
is she?
almost about 17 years of working.
It's been 17 years in long term.
Yeah, well, she graduated from. She got her family medicine residency in Long Beach, and well, she's 46, so whenever the hell she finished medical school, must have been very late 20s.
Yeah.
But only now has she started her own private practice, so she's not under pressure to see one person every 10 minutes or even 15 minutes. Is not long enough for a general medical visit.
Yeah, that's not.
For illnesses to be examined. And
that's why they run late.
Yeah, that's why they always run late.
Yeah.
And
it's not any better. I just went and saw my dermatologist, who I really like, and she was running pretty late, and she came in, I'm so sorry, one of the assistants is gone, and I said, I'm always scared, I'm like, how many patients do they expect you to see each day? And she's like, each day? And I go, how much time are you given? And she said 10 minutes.
That's horrifying.
And I was like, how are you supposed to? She goes, I'm not. I'm set up to fail. She's like, there's no way I can spend enough time and do what I need to do. And she goes, so I run late.
Yeah. My daughter, in a previous place before the place she just left, she said, 55% of my time is spent on paperwork, but on the computer. Over and over and over again, I've had the experience of one of my patients has had surgery, is going to have surgery, or et cetera. And they'll say to me after we've talked for maybe the whole session about what that is, because I can translate medical into English. And you just told me more than the 4 visits I've given to my surgeon who's going to operate. I said, well, first of all, I like to explain things. And second of all, I've got the time. We're meeting for 45, 50 minutes, whatever the hell we're meeting for.
Yeah.
And those guys have 10 minutes, 15 minutes, and they're under pressure to be in the operator. Surgeons, of course, are among the worst at explaining things.
Well, I remember Dr. Serrani, who I love, Emil, he taught a class at UCLA, and he said it was one of the first of its kind. And this was, again, back in like 2009, 2010, I guess. I don't know when he started doing it.
Called doctoring?
Yes. And it was like bedside manner, essentially.
Yeah.
And he had joked with me, he's like, you should come and talk to them because, you deal in people, you deal in conversation, and therapists know better than anybody how to tell people tough things.
You should.
And I was like, it was nothing I'd ever considered, and I'm like, oh, Dr. Strong, but why that should be a class that has always existed.
When my daughter and her husband, they both met at UCLA Medical School. They had a class in doctoring. That's why I knew the name. And I was so thrilled because I was already seeing all this, focusing on the silly examples, the gallbladder in that bed, and the without
the patient,
pancreatic cancer in that bed, not a patient with. So. But the touch, the use of yourself, so much more of the personal contact. I remember even there was in my emergency room days, I said, I don't remember this guy's name, but he was a family, they used to call him a GP. He was a general practitioner.
That's what I still call them.
Well, that's right.
I know they're family medicine now, but I still say GP.
They have more training. They're
True,
doing
they can do OBGYN stuff and all sorts of different things.
Right. Yeah, my daughter's family medicine residency was.
You almost
like
said
3
GP
years.
again. I heard it.
Yeah, I know. If she sees me say GP, she'll get furious.
I'm sure.
Yeah, but
fair. She worked really hard.
She has ample room. But what I'm getting to is this guy used to say, I believe in the laying on of hands. He says, when I go see a patient in the hospital or they come to my office, I put my hand on their hand or their forearm, and we talk. And he says, I feel like that makes him better. Now, he talked about it as if it was magical.
It almost sounds like church a little when you lay your hands.
Well, you do. You do.
But there is healing through touch.
Yes, there is.
Massage has its place for a reason. You used to get a massage do you still get your massages? Yeah?
No, well, because it's much harder to get to my house.
True, very true.
And the cost has gone up. But I love getting massage.
Same.
But I also believe in human touch.
Yeah, me too.
That human touch is an aspect of connecting with another person.
Yeah, and eye contact. I've always told my audience, I'm like, sometimes if you don't feel like you can advocate for yourself in the moment because there's too much information, it's too many questions, then bring a pushy bitch. because I was that for my grandpa all the time. I'd go to his appointments, and then when I couldn't be there, I sent my mom with a bunch of questions, because he's like, well, sis, they call me sis. So, sis, I get there and it's like there's a lot, and then I'm trying to get my new inhaler because he had COPD.
Yeah.
And, I want to learn about that. And then I forget the other stuff that you told me to ask because, as I wanted him to get a travel oxygen thing, because it was like limiting his ability to leave his home and all this stuff. And I had questions, and so if you can't do it, somebody can. But it's frustrating that we have to push that hard to get that time, to get the connection with the doctor, because they just, they have 10 minutes.
Well, and it's a very valuable thing that you're doing when you do it. Although I also hear you're a pushy bitch from your husband. So I don't know.
Lies. He tells lies. Yeah, but there is healing through touch. And I think we don't talk about those things as much because for whatever reason, and this is what I'd love to, like a documentary about like how medicine has shifted, because there's definite improvements. Like you said, all we had were the zines for a while of medicines, and they're dirty drugs, and there's lots of side effects and blah, blah, blah. But now we have all these options, and so many, now they're doing research into psilocybin, and ketamine is really effective, and we have all this stuff happening, but then we have no care. And it's like, can't we have both, The
answer is yes. And I think it is about human connection, and I think the farther we get from it, the more. I don't know about where AI would fit into this, but I think you're right. It is not a human being that is looking you in the eye and touching you on the arm and saying, "We're in this together." And I really
we're going to figure this out. Yeah.
And I don't see it as anything mystical. I actually think it's an epiphenomenon of the human race, and. Many times when you see these animal videos that show up on your FaceTime or Instagram, often reels that you haven't applied to, but of course they show lots of very loving, direct physical contact between animals, and sometimes that you don't even expect. Other animals than us.
But there was, it's almost like where nitpicking comes from, where the monkeys get.
Oh, absolutely. They pick their lice off of each other.
And that's part of their caring for each other and their community.
That's right.
Then we know there's a ton of research, whether it's Peter Levine's or whoever's, but like the polyvagal theory or your vagus nerve gets stimulated or whatever it is, but it's just through that touch. Not only, we're primed for it as babies. Yeah, and that's why they have the dads put the baby on their chest, skin
to skin, yes. Yes, I watch that with these youngest grandchildren.
I know, so yeah. So
and I often long for somebody to pick lice off of my body.
You need nitpicked a little bit.
I get nitpicked, but not in exactly the same way.
I'll call Erica. I'll just tell her just what we're looking for. Okay. So is there anything that you've heard of now when it would talk about like future treatments or futures of psychiatry, or anything that you're excited about, things that are coming down the pike?
Oh, well, the only areas that I am excited about are medical, i.e., because that's where more advancing takes place. Because we're talking about the loss of the time and energy and interpersonal sensibility. But it's true about the newer medications. It's true about things like ketamine or the psychedelics. Or I even went to a talk not too long ago, a couple of years back, where this guy was saying, one of the guys who wrote one of the books was saying that he sees there are certain opioids that he thinks that may well have psychiatric use.
Really?
Yeah, and I forget which ones. He did say it. It's one of the guys, Saltz, or one. Yeah, it was that guy.
Well, my friend Alexa, I had her and her business partner Shira on the podcast, and they do psilocybin research and MDMA. Yeah. And I'm wondering, because you said opioids, they talked about the reason that it works is that it essentially, for lack of a better explanation, lowers our ego. So it allows our defenses to be down. So Alexa described it as, instead of coming out with like machine guns ready to fight, you're able to put the guns down, lower the cannon, and see each other or see yourself.
Well, the question, of course, is obviously if if you can find a way to avoid the addiction, and of course,
Yeah.
and also, I was thinking there's a real way to lower your ego. It's called fentanyl.
And that we know is not turning out
It
that
just
great.
removes ego altogether.
Right? Removes you altogether potentially if you're not careful.
Another favorite saying of mine that I always say, life is all about dating and dosage.
And that's very true.
Yeah, and of course dating, and of course that means compatibility with many things, not just persons or music or art or whatever, but the compatibility with medications.
Yeah.
And they're also dose. If you said to me, gee, I feel like getting drunk, I'm going to have a beer. I'm going to say to you,
You're not
I don't know if you're going to get drunk.
I thought beer doesn't seem to...
Get a six-pack.
Yeah.
Not that that's a good choice, but...
No, but yeah.
So
It's the dosage.
Yeah, it really is.
It'd be like taking 1 milligram of Seroquel. You'd be like, that's not going to...
Yeah. In spite of homeopathy, which believes that, and the people who believe in homeopathy also seem to be primed to respond to minimal doses. And I do meet a few of them, and I do go ahead and tiny doses because I believe in the expectational state of a person, that if they really expect this to make them feel better, it does.
Yeah, like the placebo effect,
placebo
right?
effect,
It does exist for a reason.
Oh, absolutely.
Yeah. And I did hear, I don't know if you have any thoughts on homeopathy for mental health treatment. Have you ever seen anything actually be effective? Because there are a ton of different things people talk about, and here people in my community have had experiences.
You're from Washington, and a friend of mine, a psychiatrist, that was the best man at my wedding, Derica. He moved up there, and he had kids, and his oldest kid is a doctor of naturopathic medicine.
Interesting.
And so they do a lot in the Pacific Northwest about naturopathic and other kinds of, and homeopathic too. And
What's the difference between naturopathic and
I don't know.
homeopathic? I was like, wait, I don't know that.
I think naturopaths also do homeopathic doses.
Okay.
But I think they focus far more on non-processed medications.
Oh, okay.
And found in nature.
So it could be like a vitamin versus like something created in a lab. Okay.
And it might be, but I'm hesitant to know, because in this area I'm quite ignorant.
Yeah,
But-
I don't know either. Yeah.
But I'm glad you had to ask. Made me feel less dumb. But I have at least one patient that I see now who is helped by a tiny, tiny dose of lithium, which is like
What they call
subclinical. On the other hand, when she does take, and this is her choice actually, although I guess of course I do the prescribing, she takes clonazepam, which is, she takes a much higher than usual dose to help her, but she doesn't take it every day. She'll take
it just randomly when she feels like she needs it.
Yeah, and she has the okay from me with it, because it's maybe once a week or.
So interesting, because it's not a long acting.
Yeah, and she in turn, one of the things that helps her a lot is that over-the-counter sleeping medication that comes from a pineal gland of our brain.
Oh, not melatonin.
Melatonin. And when she takes melatonin to help her sleep, she'll take like 20 milligrams, 25 milligrams. The usual dose, it comes
like
most of the time you
5,
buy 5.
Twos or 5s, yeah.
And when I took melatonin for sleep, the 5 milligram left me with a hangover. I felt sleepy all the next
Can't
night.
focus, can't
But
think.
she takes 20 or 25.
Wow. I mean, everybody's different. I think that's the crazy part about it, right?
Yes.
It's like,
Welcome to the human race.
yeah, but I think that, I don't know if you find it this way, but it's equal parts troublesome and infuriating sometimes, because you're like, wait, but this worked with somebody else. I mean, I don't deal in medication, but I deal in like tools and techniques and like operating within certain frameworks, right? But then the other person, it would be terrible. And it's like, you're like, but it looks the same. What?
That's why I say dating.
Yes, because it's going to be different. Each person's different.
That's
and
right,
that's the beautiful part of it and like the art of it. But it's also infuriating sometimes, because it'd be nice if it was just A plus B equals C every single time. But it never comes out the same. It's like you're baking a different cake every time. You just don't know how long it's going to have to be in the oven. But I
because
know
it's the
that
lowest I
everybody
ever saw a
will
person who could
will have
walk.
this question,
And
and I
by
think
the
you have a
way,
lot of
and I
insights
called her
into
family
this.
medicine
Is if
doctor
someone is
and
seeking
got on
out
the
a
phone with him,
psychiatrist,
and
what
told him that, and
recommendations
he
would
said,
you
"Well, she
have
got
for
an
them
appointment
about
tomorrow.
what
I'll see her
questions they maybe
tomorrow."
should ask,
She was
or
dead the
what
next
things
morning.
should they look for?
Yeah.
Like give them kind
I
of
could-
a
and
behind the
I had
scenes.
said
What
to
should they
this doctor,
do to find
I
somebody
think
that's
she
good?
needs 4 units of transfusions. Yeah, IV blood. And this guy, by the way, he did call me afterwards and apologized vigorously. But it's not that I'm so smart. It's just that some things you can just tell. Yeah. But her therapist was so used to treating her depression, and was not good at picking up on physical signs. Yeah. Well, when people ask me when I say, look, I'm
That's yeah,
86 years old.
amazing.
I'm not taking that many
that
new
is great
patients
advice
unless they're
because
very
so many of
specifically
them
referred
don't.
by somebody I know, blah, blah, blah.
And if they're not, and
They'll
it's
say,
almost
well,
like
can you
dating.
refer
Back to our dating
me to
analogy.
somebody who
It's
does
like
both therapy and
if you're on a
medications
date
like I
with
was told
someone
you do?
and they never
And then
ask
I
you
get
questions
really
about
stuck
you,
because I don't know.
you don't want to see that person. They're not interested in you. They're not paying attention to you. Yeah, great advice. We've talked a lot about how you've been practicing for a long time. You've seen lots of shifts. You've worked in emergency medicine. You've worked in psychiatry for a long time. What's been the most rewarding piece or
No,
part,
and I'm
or
not
maybe
saying
a
that there aren't
story
any people. I
of
don't
your
know them.
career?
I should also add that apropos, consistent with this thing that has stayed with me about
Yeah.
not having bosses, I stopped doing hospital work many years ago, even though I was very inspired by the hospital work. But hospitals more and more have protocols and stuff like that. And if you don't give the patient a certain kinds of medications on the minute they come in, the insurance won't cover them.
Yeah.
Yeah.
I agree. Is that why you haven't retired? I always wonder because I enjoy that same thing. I think I feel like that's why we do what we do, because the impact you can have can
I
be
think it was
so.
earlier than that,
It's that
but you know
life-changing
when you
stuff,
work
and to
for
even feel for a
company.
minute that I had like the smallest part of it
Okay.
is like it was all worth it. I remember when Sean and I first started the channel, we were like, if
That
one
we're
person
doing
is
both.
helped by this, then it was all worth it, because we had no idea what we were doing. It was awkward at the beginning.
It wasn't
And,
the new ones. That's right.
it's who would have thought
That's
it would have
correct.
grown into this, and but that's like equally impactful. I also love that your office will forever be.
Well, this division
on
within
YouTube.
psychiatry and
We'll
psychology.
never lose that office.
Because I go back these experiences that make me see it as starting earlier, are because of the.
But then
it depends
it's
on when
always
you were
held
trained.
there. That's the
Yeah.
beautiful thing about video.
When I was trained at
Yeah,
VA,
thank you for talking with us. This
Camarillo
is
and
really
UCLA,
helpful. I feel like I could talk to you about a ton of different things, and obviously we can always
residency.
chitty chat.
It
But
was
it's good to see you. Thank you.
psychoanalytic. Psychotherapy was still the predominant.